The Virunga volcanic mountains rise up in the northwest corner of Rwanda and provide fertile fields for subsistence farming. But the rich and fertile soil that can nourish and grow almost anything can also bring devastation to the men and women working barefoot in the fields. The constant exposure to soils laden with silica and other soil metals can lead to a debilitating condition called podokinesiosis, more commonly known in its late stages as elephantiasis. The condition is a serious malfunction of the lymphatic system that leads to lower extremity swelling. Those suffering from this condition become outcast, where they suffer from physical, emotional, and spiritual effects of being isolated. Many have to beg on the streets to survive. The Imidido Project began in Ruhengeri, Rwanda, to address the needs of those ravaged by the condition. Based in Mason, Texas, the Imidido Project is changing the lives of men, women, and children in Rwanda, Africa, who acquired elephantiasis by working in the fields without shoes. The Imidido Project was founded by Tonya Houston of Mason, who is a physical therapist who saw a need to begin a medical clinic in Rwanda to address those unlucky enough to have this disease. Not only is the clinic providing free health care, but it is providing an environment to nurture positive relationships with this marginalized community. Treatments involve soaking and scrubbing the feet and lower legs in chlorine water. Legs and feet are scanned for open wounds and signs of infection. Special care is given when required.
To press a wound like this one, it is too expensive.
Various lotions are applied, along with a lymphatic massage. Finally, compression bandages or stockings are used to move the trapped lymphatic fluids. With the help and support of many, the Imidido Project now has sustainability. Jean-Paul, a Rwandan physical therapist, was trained by the U.S. Imidido team in January 2013 to care for the condition. Jean-Paul has a passion for helping his people. Each patient is provided with soap, a soft brush, and a personal soaking basin that cost about $4. Patients also receive aloe vera plant cuttings to grow in their home gardens, giving access to an inexpensive salve. Since the project started, they have been treating 55 to 60 people per week. Francois has been treated for nearly a year, and Jean-Paul reports that her skin is much improved and she is wearing normal shoes. This is an incredible success story.
Before Imidido, I was helpless. Now I have hope because my feet are getting better. Before, I was really, really sick and was not able to do anything. Now I'm able to do something on my own and work and generate some income with the help and support you are providing.
To aid in prevention, inexpensive shoes are being bought locally and distributed on an as-needed basis. Of course, many patients require specially made shoes to fit their swollen feet. A pair of shoes costs less than $2, but this is a huge amount of money when the average daily income is about $3. In addition to the primary treatments, the patients and community are being educated about podokinesiosis, about its causes and progression, and most importantly, prevention.
Stop. Stop. Podo. Podo. Stop. Podo. Stop. Podo.
This is my team.
When children and students see what the condition can do, they are obviously moved. Education will make a difference, and the Imidido Project is committed to early education, which stresses the importance of wearing shoes to prevent podo. To that end, Tonya, Jean-Paul, and Field Project Manager Jen Uwizeyimana travel to area schools to teach classes on prevention of podokinesiosis. The people of the Imidido Project are smiling with the hope of building a future through a milling stone project. The project will provide them an income to pay for food, shelter, and health care. The people of Imidido began this process with an organization called Spark. Spark has found a donor that will buy the milling stone and provide the startup money to begin the business of milling maize into flour. The last step is to secure a house to place the milling stone business into. The cost of a small house is $2,000 US. The Imidido Project received a $1,000 donation towards this very important sustainable business. The goal of the Imidido Project is to build a tribe of supporters from the U.S. and abroad to give a hand up to this marginalized population that beg on the streets for subsistence. Imidido continues to look for other philanthropic partners as well as support from the medical and scientific communities. With creative partnering, sufficient funding, education, and a lot of hard work, this condition will be resolved. The Imidido Project is a 501c3 nonprofit organization. Tax-deductible contributions can be made at www.imididoproject.org, or you can mail your contributions to P.O. Box 1033, Mason, Texas 76856.